Sorry, we're a little late.
It's all right.
Hey Sarah, how are you today? Okay. Hello. I have a different microphone configuration. I knew it had to be a... You good? It's usually right here, which is sort of the worst possible spot. So this is actually much better. Yeah. You good?
Yeah, I'll put it up
Okay.
in the front.
Yeah.
And then you push it on the side.
Whatever. All right. Well, good afternoon, everybody. Welcome to Friday. Today is Friday, May the 8th. This is the end of the 9th week here in Montgomery County of living with the coronavirus. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I am here with Vice Chair, Commissioner Ken Lawrence, and Dr. Al Wong, our Regional EMS Director. So, since yesterday's press briefing, we have had notice of 101 new cases of COVID-19 in Montgomery County, which brings us to a total of 4,939. 33 of these 101 new cases are from a long-term care facility, or from a variety of long-term care facilities. These positive individuals are from 29 municipalities, none of which are reporting new cases. So this keeps us at 61 of our 62 municipalities that are home to individuals with COVID-19. These individuals range in age from 8 years old to 91 years old, and you can check our maps at macopa.org/COVID-19 for updated municipal data. Today we have 53 females and 48 males. One is known to be hospitalized. One is known to be at home in isolation. We have 33 in long-term care facilities, and the remainder are not known. I'm also saddened and sorry to confirm that 12 more Montgomery County residents have lost their lives to COVID-19, which brings us to a total of 405 confirmed positive deaths from COVID-19. 3 of these individuals died in a hospital, 7 at a long-term care facility or a home, and 2 we don't have information about. They ranged in age from 58 years old to 95 years old. Overall, we have had 220 females and 185 males lose their life to COVID-19 here in the county. The self-identified racial breakdown: 12 Asian, 3 Asian Indian, 3 Asian Korean, 35 African American or Black, 109 white, and 243 we don't have information on. Now, in terms of probable deaths, and again as a reminder, this is an individual whose death certificate notes COVID-19 as the cause of death, but we do not have laboratory confirmation on that individual. Today we have 185 total probable deaths. Adding that to our confirmed positive total for the day takes us to 590. And just a reminder, some of these probable deaths do eventually become confirmed, and then we note them in the confirmed positive list. So our hospital beds continue to do okay. We are down just a tiny bit from yesterday. Again, this is great news. This is certainly the direction that we'd like to see them go. But we continue to see people being hospitalized for fair periods of time, and we continue to have about 25% of these individuals on ventilators in order to get enough oxygen to breathe. So the individuals that are hospitalized tend to be fairly ill with COVID-19. Update from our long-term care facilities: we have 93 facilities that are reporting positive cases of COVID-19 in their staff or residents. Today we have 1,329 cases from residents, 526 from staff. Just the reminder that these are not all Montgomery County residents, and so these numbers do not add up to our total number. But the total amount between residents and staff is 1,855 positives. From Montgomery County residents, we have 334 confirmed positive deaths of long-term care facility residents that are actually technically Montgomery County residents. That is 82% of our total confirmed positive deaths. We continue to do outreach to these facilities. By the end of the day yesterday, our FAST team had visited 60 facilities, and they are out today conducting 12 visits. So these visits continue to be very collaborative. They seem to be very helpful for the localities that we're visiting, answering lots of questions, making sure they have enough PPE, providing guidance on testing. We do continue to encourage as much testing as the facility is able to provide, and of course then the appropriate response to that testing in terms of cohorting residents and perhaps isolating and quarantining staff. At our correctional facility today, I do have an update. 2 of the inmates of the 171 who tested positive have now developed symptoms. So those individuals are being watched very closely. The remainder of those that had tested positive do remain asymptomatic. Our community testing sites, a couple of updates here. First of all, the Norristown site will be closed for the weekend, as is their practice. They will open again on Monday. That is located at the Delaware Valley Community Health Center. It is a walk-up clinic for residents of Norristown Municipality only, and appointments for Monday can be made starting at 8:30 Monday morning by calling 610-592-0680, and you will be able to make an appointment for between 11 and 1 o'clock on Monday. Weather permitting, they will be open Monday through Friday next week. The Montgomery County Community Drive-Through Site, Community College Drive-Through Site, is also open and running today. Thanks to everybody involved in that. As of May the 6th, we have now tested 4,141 individuals at that site. So that's between April 16th and May the 6th. 4,141 individuals have been tested. We've received results on 3,768, which is 91% of the total. 590 of these individuals are positive. So for these first 18 days, we have been running 16% positive. So it's good to see we're staying pretty stable there. The drive-through site will not be open tomorrow, Saturday, because of the weather forecast, which is pretty awful. And they were not planning to be open on Sunday either. So the drive-through site at the community college will be open next on Monday. So Monday morning, you will be able to start at 8 a.m. making appointments for Monday. You can make it online at moncopa.org/COVID-19 by clicking on the green County Testing Information button, or you can call 610-631-3000. And again, that begins at 8 a.m. on Friday. Now, I have really great news for our constituents in Pottstown. Thanks to a tremendous amount of work and effort on Commissioner Lawrence's part, tomorrow only, this is one day, in Pottstown, there will be 250 tests available for people in Pottstown or in that surrounding area. This will also be a walk-up clinic. It will begin at 10 a.m. and run until 4 p.m. at the Second Baptist Church at 507 North Adams Street. And anyone who has symptoms of COVID-19 or is known to have been exposed to someone with COVID-19 in the last 14 days is welcome to be tested. There is no cost for this testing. It does not require a doctor's order to be tested. What you do need to do, though, is register for a test. So to register for the test, go to www.realconciergemedicine.com. So I'm going to spell that for you. www.realconciergemedicine.com. CIERGEMEDICINE.com. So realconciergemedicine.com. And again, this is tomorrow in Pottstown at the Second Baptist Church at 507 North Adams Street between 10 and 4. And it is a walk-up testing site. So again, thank you, Commissioner Lawrence. Thank you to the Black Doctors Organization that is doing all this work pro bono, and we're really, really grateful that you have come here to help our constituents in Pottstown. Now, going forward, we are going to have another testing location in Montgomery County. Rite Aid Pharmacy is opening up next week, I believe starting on Monday, their store in Lansdale. That address is 1856 North Broad Street, 1856 North Broad Street in Lansdale. This is no-cost testing for anyone over 18, and appointments may be scheduled starting on Sunday. Those appointments are scheduled by going to www.riteaid.com/pharmacy/COVID-19-testing. So we'll try to get all these URLs up on our Facebook page, right? Mercury can get that done. But let me just read that one more time. www.riteaid.com/pharmacy/services/COVID-19-testing. So that's the Rite Aid on North Broad Street in Lansdale. They're going to start up testing there on Monday. And again, no cost, but you do have to be over 18. And I believe they are welcoming anyone who would like to be tested. Also for this weekend, tomorrow we will do a press release. That will only be for tomorrow. On Sunday, we are allowing everyone to spend Sunday with their families and celebrating Mother's Day, if that is possible in their family, so you will not be hearing from us on Sunday. Okay, so a couple of comments on our today's graphic, which is kind of busy, but really important. So first of all, I want to confirm that Governor Wolf's stay-at-home order has been extended to June the 4th for counties that remain in the red phase, which does include us here in Montgomery County. And I want to just show this chart share this chart with you to give you a sense of where we're at here in the county and why this is important. This chart was created by an interdisciplinary team from the Children's Hospital of Philadelphia and the University of Pennsylvania. So these are our own folks here, our friends and neighbors, and they work to take our data and use it to represent a range of potential future scenarios that we could be facing here in Montgomery County. First of all, I want you to ignore the colors. The colors are CHOPS colors. The colors on this chart have nothing to do with the governor's phases, so don't get hung up on the colors. So we are, after great work here in the county, at this point, I'm going to step in front of Sarah for 1 second. We're right here, so that's where we are today, approximately. And this chart shows what would happen under a couple of different choices that we might make in our lives in terms of how much we stay at home and how much we decide to go out. So the dark blue line, which continues way, way down and is almost completely at 0 by August, would represent a continuation of the governor's stay-at-home order or the red phase through mid-August. Now, this might be the best option from a public health standpoint, but obviously we need to take into account other factors and begin to relax some of the standards that we're under so that we can get our businesses back to work and our children back into summer camps and other types of activities. So here's a couple of options. The yellow lines represent a relaxation by about 50% of the social distancing that we had before we ever started this pandemic. So what might those yellow lines mean? Let's say that you have a dozen people over for brunch this weekend for Mother's Day. Not people that are in your household, but people from other households that all come over to your house for Mother's Day brunch. That would be about a 50% change from something that where we might have been before this whole pandemic started. So it's putting us about 1/4 of the way back to normal, to non-essential travel. So the dotted yellow line shows what happens if we do this on May 15th, and the solid yellow line shows us what happens if we wait until June 1st. So you can see two very different outcomes depending upon when we relax our stay-at-home orders. And that just has to do with how much of the virus is present here in our region. So the point being that if we sort of hang on a little bit longer, a few more weeks, we stay the course, when we do start to relax, as I said before, we will be living with this virus, but the number of cases that we'll be living with will be a lot lower. Contrast that with those two red lines. The red lines represent a relaxation to 33% of the social distancing that we had before the pandemic started. So an example of that might be your child, like my twins, are graduating from high school in a couple of weeks, and you decide to have 50 people over for a graduation party. That would be a pretty big reduction from where we're at now. You can see that a choice like that could have some really devastating consequences. If we did that on May the 15th, you could see by 4th of July, that red line, that dotted red line, way, way, way back up into numbers, frankly, by August even, numbers that we've never seen here in this county. And even if we waited until June 1st, if we do that significant of a relaxation, we're still going to have quite a few cases over the summer, and a line that's going up, not down. So remember, our goal here is to keep these lines going down. We need to stay the course and stay at home until we have enough of a decrease in the presence of the disease here in our community that when we do start relaxing the guidelines and people start going out a little bit more, that we can do it safely. We know we're going to be living with this disease for a while until there's a vaccine, but we can do it in such a way that it's manageable, that the numbers of cases will not overwhelm our hospitals and overwhelm our first responders. So these are decisions that we all have to make right now. Folks, this is really, really in your hands. I can stand here and talk for hours about why it matters to stay home, but at the end of the day, the decision rests with you. And the longer you can stay the course, the longer you can be very careful when you go out, maintain physical distance, keep that mask on, stay out of stores that aren't with the program and aren't set up to properly keep their customers socially and physically distant. These are the choices that you have to make. And I hope that everybody is using this time to think about what it will be like when they're able to go back to work if you're not at work now. What you can do in your business. Can you continue to work from home, or can your business be set up in a way to help make it as safe as possible? This is just a picture of how quickly this could turn around and go the other way. And again, I just remind you that this is from local folks in our region that did this work, people that are deeply invested in making sure that our communities stay safe. So with that as the background, I just want to take a moment here on a Friday afternoon to celebrate our community. I sent out a message a couple days ago asking for just kind of some recent check-in with some of our county departments and some of our community organizations on what has been accomplished in the last 9 weeks. It's actually kind of hard for me to remember what it was like 9 weeks ago. We have literally transformed everything that we do. The way we go outside, the way we work, who we see. We've been through holidays and missed celebrations and businesses that are shuttered. But underneath all of that has been our community, and our community has been incredibly strong. So I just want to share a few accomplishments with you. starting with our 22 Montgomery County school districts, who I talk to those superintendents just about weekly, and I hope everybody really appreciates their school superintendents right now. They have been phenomenal in the leadership that they have shown. And they told me yesterday that our school districts have provided approximately 750,000 meals to students in Montgomery County school districts since March the 16th. That's pretty incredible work. So kudos to them, to all the volunteers that have helped make that happen. We are so grateful for that. Our Make Masks for Monco Facebook page. It now has 2,435 members. Those amazing people have donated 20,673 masks, 12,169 to individuals and families in the community, and 8,504 to healthcare and essential businesses. That is amazing. Our county's Office of Drug and Alcohol, working through our contracted providers, has been compiling and sending resources to all of our school districts and offering teacher training opportunities to help them do that type of work online. They've offered virtual support groups for students and a mentorship program, and they've created over 40 videos on topics ranging from vaping and cigarettes to social media to social emotional learning, mindfulness, and hand washing, the all-important hand washing. We have had incredible numbers of donations of goods and supplies to the county. I want to just give a special thank you to Arcadia University and to Prudential, both of whom have donated considerable numbers of items. But so is the public. The public has been so helpful every time we have called for that help. So just to give you a sense, over 2,795 masks, over 107,000 procedure masks, 104 face shields, 511 gowns, over 200 boxes of gloves, 122 pairs of eye protection, 500 half-gallon bottles from Wawa, 50 empty bleach jugs that we refill with hand sanitizer to give to others, Tyvek kits, Tyvek suits, 250 N95 respirator kits, and over 250 N95 mask kits. We are so grateful for these contributions, and it's made a huge difference. Your Way Home, which is our group that works to end homelessness in Montgomery County, has provided hotels for 95 people who were previously sleeping on the street or in a shelter. 1/3 of these folks were children. So we are so grateful for that work. That allowed us to decompress our shelters by about 50%, making it much safer in the shelter environment as well. And even during this pandemic, they have been able to find permanent housing for 22 households, which is 40 people experiencing homelessness. Seniors have continued to get home-delivered meals to over 670 eligible seniors on a weekly basis. RSVP, our partner in the community, has recruited or referred out more than 436 volunteers for our county and surrounding counties as well, just in this short time. RSVP has distributed 1,100 surgical masks to seniors in the community, and our Office of Senior Services is currently providing well-check calls several times a week to over 100 seniors who are living alone through a partnership with Arcadia University students. PA CareerLink here in Montgomery County, since March 16th, both Monco Works and CareerLink staff have worked closely with job seekers and employers, placing or returning over 6,500 calls to provide services and critical guidance related to unemployment compensation and basic needs. And round 1 of our Monco Small Business Grant Program has awarded 43 grants totaling just under $1 million to small businesses in Montgomery County. And of course, round 2 will open next week with $5 million to allocate. So folks, that's all in 9 weeks. I just, every day, can't tell you how proud I am of this community and how strong everyone has been and how people have pulled together to help their friends and their neighbors. And we just have to keep at it a little bit longer. We have to stay the course. We will get through this. and we will get through this in good shape. So with that, I'm going to turn over to Commissioner Lawrence.
Good afternoon. I'm going to speak about the election again today, but I'm not speaking about polling locations. I'm going to speak to the 80,000 voters who have registered, who applied to vote by mail in this upcoming election, and we anticipate that we'll have many more voters who will do that. So we understand that if you have applied, you're eager to get your ballot, and we want you to know that applications have been processed and ballots should be being mailed daily now. But if you would like to check on the status of your ballot, the Pennsylvania Department of State has a website so you can track your status. And the website is www.pavoterservices.pa.gov. Once again, it's www.pavoterservices.pa.gov. And I actually did it this afternoon to check on my application. It'll show you several columns. It'll show you when your application was received, when your application was processed by the county, when your ballot was mailed, and then when you return your ballot, it will show when your ballot is received by the county. And we want people to remember that the post office is saying that it's taking anywhere from 4 to 6 days for normal mail to arrive. So if you see it was mailed on May 5th, you can add 6 days to that. Our voter services office is open for questions, and it's 610-278-3275. But we would really suggest and recommend that people use the website if possible. And then if you see that your ballot was mailed and you haven't received it after 5 days, then call then. It's very simple, very easy, and the final tab will show when your ballot is actually counted as well after the election on June 2nd. Val mentioned the Monco Strong Small Business Grant Program. We're going to mention that again, and we'll probably mention it every day too to make sure that as many businesses as possible know about it. And that will launch on Wednesday, May 13th from 11 a.m. to 6 p.m. The updated guidelines and additional information is available on the program website, which is www.moncopA.org/MoncoStrongSBGP, or as always, you can go to our county website and the COVID-19 hub. We've had a lot of appreciations this week, and we will end the week with its National Teacher Appreciation Day, and I'm sure we're all appreciating our teachers even more. Montgomery County has 21 active school districts, which includes over 150 public and 230 private schools, and serves 116,424 public school and 38,542 private school students. And our teachers change their lives each and every day. And I can speak from teachers that I know, including my brother-in-law, Mel Johnson, how difficult it has been for them to go to a virtual learning experience. Many of them are working much longer hours to prepare the lessons, but in grading and trying to keep our students engaged. I have a high schooler at home, and I'm grateful to all of his teachers because I can't keep him engaged, so I know that they are doing so. So we should appreciate our teachers all of the time, but let's give them a special recognition today, send them a note, send them thanks. We thank all of our teachers in Montgomery County. And I would also like to wish all of the mothers a happy Mother's Day. We have several mothers here in this room. My mom, who I have not been able to hug for 8 weeks now, and yes, I still do hug my mother when I see her. But let's also remember those who have lost their mothers due to this, and this will be their first Mother's Day, and while they're still mourning their mothers as well. And with that, I'll turn it back to Val.
Okay, happy to take questions.
Is it bad time to ask an election question since it just got down?
Go for it.
I'm going to be nice.
What if someone doesn't get their ballot in time, or if they're looking for it, if they're concerned about it, because as you know, a lot of people are very concerned about the mail-in ballots.
Yes.
So if you have a problem, if you don't see it, you don't think it's going to show up, what's the recourse?
So the question was, what should someone do if they don't receive their ballot? So if they use the website that I just gave out, and they see after 5 days that it's saying that their ballot was mailed, they should absolutely call voter services. So we should figure that out. And I would encourage people not to wait on that, because the closer we get, we can only count ballots that are in our office by 8 p.m. on Election Day. It's not the postmark for June 2nd. So if the ballot is not in our office by 8 p.m. On Election Day, it will not be counted. So certainly as we get closer to those deadlines, we hope that people will utilize this website, and you should absolutely call voter services if you haven't received your ballot and they're telling you it's been mailed.
And don't wait until Election Day to think that that's when you.
Don't wait until election. Yeah, the question was, can you wait until Election Day? No, don't wait until if you want to vote by mail, you really want to have your ballot in as quickly as possible. And I would encourage people too, as you receive your ballots, please don't wait until May 30th, till May 29th, May 28th to mail them. You'll want to fill out your ballot and get it mailed back in.
On the in-person voting with consolidated polling places, there's a lot of concern for people who were still confused by the new paper ballots last time. How do you plan to help out people with social distancing if people have questions if they're confused by it?
The question was, how are we going to help out people who might be using this system for the first time? We were absolutely practicing social distancing there. People will certainly answer questions. We will have masks and gloves for all of our poll workers. We have several online tools as well too that actually show the new system. We rolled them out last year, but they are still there. So if this is your first time voting with our new voter marked ballot, I would encourage people to go to the Voter Services website as well to look at some of those videos as well, to try to familiarize yourself with that before you get to the polling place.
And just one more thing, our ballots are all coming with a postage paid return envelope. So nobody has to try to go buy a stamp in the middle of all of this. So, all right.
Secretary Levine today said that there was a call with Southeastern PA leaders. Do you have any info on that, or can you shed any light on what those discussions might have been?
Dr. Tom Farley from the Philadelphia Department of Health and myself and a couple of our team had a conversation with some members of Secretary Levine's team, and I don't have any information from that call that I can share.
Can you generally say, she said it was about lifting restrictions and what it might look like to lift those restrictions?
It was a very general conversation. We were going over some of our data here in the Southeast. They were interested in what we thought our projections might be in terms of when we might get to yellow, that sort of thing. But they're going to be thinking about some of the ways that they're presenting their data, how to better quantify what yellow really means, some of those types of things.
And she also mentioned significant community spread. Do you have any way to kind of track that, since you're not doing the contact tracing? Is there any way to kind of view community spread? We
have significant community spread, and we've had that for weeks. So I think it's hard for me to put like a number on that. It's I think you can look at charts like this and get a sense for if you go out into the community in a very relaxed fashion and hang out with folks and stand shoulder to shoulder in line at the grocery store and other things like that, there's enough virus in our region that we're going to be on one of those red lines, rapidly escalating case numbers again. So at this point, we assume, I think that anyone should assume that any of us could be, in theory, asymptomatic carriers, and that we should take the appropriate steps. So stay physically distant, keep those masks on when you're out in public, and try to minimize those public trips. He took a breath in, so I was just giving him the chance to.
Out of Western Pennsylvania, and I know you're not affiliated with Beaver County, but there was they were not moved out of the red into the yellow, and there's frustration there. And the district attorney of Beaver County has basically, poor summary of everything, has basically said that businesses who don't follow the restrictions will not be prosecuted. As a health professional, as someone who's been heavily involved with these policies, what is your thought on hearing something like that?
Well, as I've been saying for weeks now, sort of three things really. Number one, this virus is everywhere in our community, and every person needs to decide how they best want to live with this virus and what they're going to do to be personally responsible to keep our community as a whole on one of these lines that's going down over time instead of one of these lines that's going up over time. And that's where we're at. Like, it's a simple thing. I don't believe that we can arrest or prosecute our way out of this pandemic, just like we cannot legislate our way out of this pandemic. What is going to get us out of this pandemic is every one of us taking personal responsibility in our daily lives and in our work lives to do everything that we can do to help keep ourselves and our family and our friends and our neighbors and the rest of our community safe. We've showed the graphics of the impact that one person can have. One highly contagious person who is out in the community, and how quickly that can escalate to having an impact on over 100 people. So it's all up to each of us, folks. That's where we're at. This is in your hands. You can do the right thing or not, but those of you who do not, you will keep us much closer to those lines that are going up instead of those lines that are going down. Nothing? Nothing? All right. So, press release tomorrow, and then we will see you in person on Monday. And happy Mother's Day to everybody who's celebrating, and please celebrate from a distance. Thank you. Have a good weekend.